Hi everyone, welcome to Mammography series. In this video we will discuss about mammography. I am sure, and in this video you will get all the information about mammography. So let's get in. Definition of mammography. Mammo defined as breasts, and graphy defined as image. So it is an image of breast. What is mammography? Mammography is specialized medical imaging that uses a low-dose X-ray system to see inside the breasts. A mammography examination, also called a mammogram is an X-ray of the breast. It is a screening tool used to detect and diagnose breast cancer. Screening mammograms are a key element in the early diagnosis of breast cancer. There are two types of mammography. 1. Screening mammogram. If your doctor orders a mammogram as a routine test to check for any cancer or changes, it is known as a screening mammogram. 2. Diagnostic mammography. Diagnostic mammography is used to evaluate a patient with abnormal clinical findings such as a breast lump or other symptom of breast cancer that have been found by the woman or her doctor. Diagnostic mammography may also be done after an abnormal screening mammogram, in order to evaluate the area of concern on the screening exam. What are the benefits of mammography? Screening mammography reduces the risk of death due to breast cancer. It is useful for detecting all types of breast cancer, including invasive ductal and invasive lobular cancer. Screening mammography improves a physician's ability to detect small tumors. When cancers are small, the woman has more treatment options. The use of screening mammography increases the detection of small abnormal tissue growths confined to the milk ducts in the breast, called ductal carcinoma in situ, DCIS. No radiation remains in a patient's body after an X-ray examination. X-rays usually have no side effects in the typical diagnostic range for this exam. What age should a woman get a mammogram? Women ages 40 to 44 should have the choice to start annual breast cancer screening with mammograms if they wish to do so. Women age 45 to 54 should get mammograms every year. Women ages 55 and older should switch to mammograms every 2 years or can continue yearly screening. Screening should continue as long as a woman is in good health and is expected to live 10 more years or longer. Preparation for mammography? You will need to follow certain guidelines on the day of your mammography appointment. You do not wear deodorants, body powders, or perfumes. Also, you should not apply any ointments or creams to your breasts or underarms. These substances can distort the images or look like calcifications or calcium deposits, so it is important to avoid them. Do not schedule your mammogram for the week before your menstrual period, if your breasts are usually tender during this time. The best time for a mammogram is 1 week following your period. Be sure to tell your radiologist before the exam if you are pregnant or breastfeeding. In general, you won't be able to receive a screening mammogram at this time, but if necessary, your doctor can order other screening methods, such as an ultrasound. Describe any breast symptoms or problems to the technologist performing the exam. Obtain your prior mammograms and make them available to the radiologist if they were done at a different location. This is needed for comparison with your current exam and can often be obtained on a CD. No fasting required. Written consent form must be signed by patient. You will need to undress from the waist up and taking off any necklaces, then you have to wear smock or gown that ties in the front. What does the mammography equipment look like? A mammography unit is a rectangular box that houses the tube in which X-rays are produced. The unit is used exclusively for X-ray exams of the breast, with special accessories that allow only the breast to be exposed to the X-rays. Attached to the unit, there is a plastic plate, and another parallel plate called a paddle, that holds and compresses the breast and positions it, so images can be obtained at different angles. How mammography performed? A specially qualified radiologic technologist will position your breast in the mammography unit. You will stand in front of a mammography machine. A technologist will place your breast on a plastic plate and compressed with a parallel plate called a paddle. The plates will flatten the breast, holding it still while the X-ray is being taken. You will feel some pressure. You must hold very still and may be asked to keep from breathing for a few seconds while the X-ray image is being taken to reduce the possibility of a blurred image. An X-ray machine produces a small burst of X-rays that pass through the breast to a detector located on the opposite side. The detector can be either a photographic film plate, which captures the X-ray image on film, or a solid-state detector, which transmits electronic signals to a computer to form a digital image. The images produced are called mammograms. The steps are repeated to take a side view of the breast. The other breast will be X-rayed in the same way. You will then wait while the technologist checks the 4 X-rays to make sure the mammogram images do not need to be redone. In a standard mammogram, both a top and a side view are taken of each breast, although extra views may be taken if the physician is concerned about a suspicious area of the breast. What will you experience during the procedure? Everyone experiences mammograms differently. Some women may feel pain during the procedure, and others may not feel anything at all. Most women feel some discomfort during the actual X-ray process. You will feel pressure on your breast as it is squeezed by the compression paddle. Some women with sensitive breasts may experience discomfort. If this is the case, schedule the procedure when your breasts are least tender. Be sure to inform the technologist if pain occurs as compression is increased. If discomfort is significant, less compression will be used. Always remember, compression allows better quality mammograms. Why does the breast need to be compressed? Compression holds the breast in place to minimize blurring of the X-ray image that can be caused by patient motion. Also, compression evens out the shape of the breast so that the X-rays can travel through a shorter path to reach the detector. Who interprets the results and how do I get them? A radiologist, a doctor specifically trained to supervise and interpret radiology examinations, will analyze the images and send a signed report to your primary care or referring physician, who will discuss the results with you. What will the results look like? A radiologist will carefully examine a mammogram to search for high-density regions or areas of unusual configuration that look different from normal tissue. These areas could represent many different types of abnormalities, including cancerous tumors, non-cancerous masses, called benign tumors, fibroadenomas, or complex cysts. Radiologists look at the size, shape, and contrast of an abnormal region, as well as the appearance of the edges or margins of such an area, all of which can indicate the possibility of malignancy, cancer. They also look for tiny bits of calcium, called microcalcifications, which show up as very bright specks on a mammogram. While usually benign, sites of microcalcifications may occasionally signal the presence of a specific type of cancer. If a mammogram shows one or more suspicious regions that are not definitive for cancer, the radiologist may order additional mammogram views, with or without additional magnification or compression, or they may order a biopsy. Another alternative may be referral for another type of non-invasive imaging study. Why follow-up exams are needed? Sometimes a follow-up exam is done because a potential abnormality needs further evaluation with additional views or a special imaging technique. A follow-up exam may also be done to see if there has been any change in an abnormality over time. Follow-up exams are sometimes the best way to see if treatment is working or if an abnormality is stable or has changed. Minimizing radiation exposure? Special care is taken during X-ray examinations to use the lowest radiation dose possible while producing the best images for evaluation. Modern X-ray systems have very controlled X-ray beams and dose control methods to minimize scatter radiation. This ensures that those parts of a patient's body not being imaged receive minimal radiation exposure. What are the risks of mammography? Because mammography uses X-rays to produce images of the breast, patients are exposed to a small amount of ionizing radiation. For most women, the benefits of regular mammograms outweigh the risks posed by this amount of radiation. The risk associated with this dose appears to be greater among younger women, under age 40. However, in some cases, the benefits of using mammography to detect breast cancer under age 40 may outweigh the risks of radiation exposure. For example, a mammogram may reveal that a suspicious mass is benign and, therefore, does not need to be treated. Additionally, if a tumor is malignant and is caught early by mammogram, a surgeon may be able to remove it before it spreads and requires more aggressive treatment such as chemotherapy. That's all for this video. If you want any video on radiology topics, please write comments in comment box. Do subscribe our channel to get notification of our new video. Till then, stay tuned.